Welcome to Wellness Wednesday. My name is Amy. I'm an Administrative Services Manager here at Bagot, and I wanted to talk today. September is Multiple Cancer Awareness Month, basically. Childhood, lymphoma, leukemia, ovarian, prostate, thyroid, and uterine. It is Awareness Month for all of those cancers, and I guess I mostly want to touch on, make sure that you are aware of your risks for those types of cancer. Maybe it's a family history, a particular age group, maybe it's a lifestyle. Do some research, just kind of look into what are the risks of those, what are the symptoms to look for. Make sure that you're talking to your doctors about any of your risk, any things that you should be looking for, and make sure that you're getting your screenings that can be done for any of those types of cancers. I wanted to touch on one in particular. Ovarian cancer is actually known as the silent killer. And that is because it's believed that most of the symptoms don't show up until really it's already spread. However, they're starting to find there are certain symptoms that you can look for that might be an indicator. Ovarian cancer, every year almost 22,000 women are diagnosed with ovarian cancer, and over 14,000 women die from it. So that is part of why it's called the silent killer. It's getting diagnosed a little too late. I have actually talked to women that thought that their pap smear was a way that they were checking for ovarian cancer, and there really isn't a screening for ovarian cancer. The only way they can check for it is with a transvaginal ultrasound, and those aren't something we're getting every day, thank goodness, really. But if you're having symptoms, then that's something they can do to check for it. So symptoms that you should be looking for when it comes to ovarian cancer are abdominal bloating or swelling, quickly feeling full when eating, and weight loss, which can probably follow the fact that you feel full when you're eating, so you're not eating as much, and so you start losing weight. Discomfort in the pelvic area, changes in your bowel movement, specifically more of a constipation kind of thing, and a frequent need to urinate. Those are all things to kind of be looking for. Now, don't run out and panic that if you have one of those things going on right now, that immediately that must mean that you have ovarian cancer. But what it means is be aware. Talk to your doctor. If you are having one of those symptoms, or especially if you're having multiple symptoms, mention it so that they can do an ultrasound, that they can do some of the blood tests that are out there to look for that, and get checked, because you don't want to be one of those statistics. There we go. It's not a good day for S's, apparently. So you don't want to be on that number. You want to get that kind of checked for as soon as possible, right? So again, checking with your doctors about any of the screenings that you should be having. This month is just, it's a good reminder to be checking for all types of screenings and any type of cancer, because there are so many that we are trying to raise awareness on this month. I also want to point out, if you've been diagnosed with cancer, if you know someone who's been diagnosed with cancer, you can order one of our Bagot bags at our website, bagotcancer.org. Our general Bagot is made for anyone with any type of cancer, so it can be helpful guiding you through that diagnosis at any point. But we also do have a couple cancer-specific bags. We have a CLL bag that I'd like to bring awareness to on this particular month. It is chronic lymphomic leukemia. I'm saying the second word wrong. I don't know. CLL. If you've been diagnosed with it, you will know. And also we have a uterine-specific cancer bag that you can order on our website. So again, if you've been diagnosed, or if you know somebody who's been diagnosed, you can find those at bagotcancer.org. And again, just touch on it one more time. Talk to your doctors, get those screenings, make sure you're making those appointments, whether they need to be yearly or bi-yearly or monthly, whatever appointments you're needing to get, make sure that you're making those and getting those screenings. All right. I hope you have a fabulous week, and we will see you again next week.